Hi, I'm Dr. Jake Taylor with Bellwood Animal Hospital. I'm here with my dog Max, and we were going to show you how we do a kind of general physical exam here and things that I'm looking for especially. So when I do a physical exam on a dog, I think it's really important to get a good history before starting. Are they eating and drinking okay? Going to the bathroom okay? Are they here just for shots? Are they here for because their dog's vomiting or their skin issues, things like that? And that kind of guides what I focus more on a general physical exam. So first thing I kind of look at when I go into a room, what's the dog like? Are they nice and alert? Are they kind of depressed and dumpy? Do they feel kind of crummy? Are they going to try and bite me? Things like that. So, and then I kind of guide things from a nose to tail approach. And the most important thing is just doing the same thing you do on every dog. And every doctor may have a different approach of doing this, a different order of things, but I kind of have a general approach that I go from nose to tail. So I first focus on their nose, make sure there's no nasal discharge, nostrils are nice and open, and that looks good. We'll look at Max's eyes here. And when I lift these up, I'm looking at the white of his eye, looking at the pink part of his eye called the conjunctiva, make sure his pupils look good. That all looks good, they're both symmetrical. And then I'll look in his ears. Look for any kind of redness, any kind of discharge in there, make sure they look clean, and if there's any doubt, I'll get an otoscope and look at his eardrum. That all looks really good. And then we'll take a really good look at his teeth on both sides. And then we'll also open this up, and sometimes we can't do this on fractious dogs, but Max is being cooperative. And that all looks good. We'll look at the back of his throat and his tongue too. And then it may just look like I'm petting your dog when I'm doing a physical exam like this, but I'm actually feeling for lymph nodes here and salivary glands that are located right behind his jawline. He's got more lymph nodes here and in his armpits. And then he's got more lymph nodes here in his hind legs and his groin. Those all feel good. And while I'm doing that, we'll look at his feet and make sure he's not licking there, there's not saliva staining, all look good. In his nails, there's no lumps or bumps in his toes. And then we'll look at the skin on his belly and make sure he's not licking back there, that there's no signs of a rash or a staph infection in the skin back here, and that all looks good. And then while we're back here, we'll perform an abdominal palpation on him. While I'm doing that, I can feel his bladder, I can feel his spleen, his liver, intestinal loops, his stomach, and feeling for any thickening of anything. Make sure there's no lumps or bumps in his belly as well. And everything feels good, everything's nice and soft and non-painful. Then the last thing I usually do after looking up behind his tail is listen to his heart and lungs here on both sides. That all sounds good, and that's kind of part of a nose to tail general physical exam.